Good evening, good afternoon, and good morning. This is the 895th day of uninterrupted and continuous webinar conducted by International Forum for Promoting Homeopathy. Today, our guest is Dr. J. Kathiravan M.D. Psychiatry. Let us begin the session with 1 minute silent prayer. Thank you. All of you know that we are about to celebrate the first family meeting of our members at Cochin on this coming 19th February. That is the next Sunday from 9 to 5 p.m. It will be a grand occasion to celebrate our 900th day celebration also. As you know, within 5 days, that is on the 17th of this month, we are celebrating the 900th day of this continuous webinar from International Forum for Promoting Homeopathy. As you all know that the forum is formed by a group of homeopathic lovers as well as homeopathic doctors and students. And we are conducting 2 sessions regularly, one from English session from 8 p.m. to 9, and from 9 to 10, we have a local language session in Malayalam. Both are having very good participants for regular sessions continuously, and there is no doubt about that. As you know, today our guest is none other than Dr. J. Kathiravan. He has qualified MD from in psychiatry. That is something great because homeopathic doctors are becoming psychiatrists as well as different specialists. This is something a new revelation that has happened in the history of homeopathy. We are also growing day by day, one by one. And as you know, he is working as an assistant professor, Department of Organon of Medicine and Philosophy in RVS Homeopathic Medical College Hospital, Coimbatore. And he has completed BHMS in 210 at Martin Homeopathic Medical College Hospital and completed MD at Vinayaka Mission Research Foundation, Salem. Specialization, as already we told that it is from psychiatry. A lot of psychiatric cases were presented in this forum by different doctors, and all were thrilling because nobody can believe that homeopathy can do such wonders in psychiatry. And he has another degree in postgraduate diploma in guidance and counseling from Annamalai University in 2010. He has published so many literatures, and one is the International Journal of Homeopathic Science, 2020, the effectiveness of homeopathic medicine in illness, anxiety disorders among young adults, peer-reviewed. The second one is the Vital Informer in October 2021, functional abdominal pain. 3, homeopathy, March 22, ischemic leg ulcer. He's a resource person at different forum, presented a webinar in role of homeopathic medicine in COVID-19 on 5th of June 2021, organized by SNN College of Arts and Science. He's a resource person for the CMA Awareness of Eye System, Homeopathy and COVID-Appropriate Behavior, organized by RVS Matriculation High Secondary School at Coimbatore on 5th October 2021. He has presented a paper on homeopathic management of HD on 10th March, organized by Homeopathic Awareness Association, Coimbatore, and he has presented another paper on health for all in March 18th of 2022, organized by Government Boys High Secondary School, Salem, Coimbatore. And today we are about to discuss auxiliary mental regimen. Let us welcome Dr. Kathiravan J. to the session. We are proud to welcome you, sir. You can begin the session. Thank you, sir. And you can go ahead with 40 minutes presentation, and there will be a 20-minute discussion thereafter, sir.
Good evening, sir. Thank you very much, and good evening, one and all. So I'm happy to participate in such a wonderful platform, IFPH. I'm very happy to see such. You are giving a wonderful effort to enrich the knowledge of homeopathy, sir. I'm happy, especially. I just thank you, sir. Today, shall I start with the session, sir?
Yes, yes.
Today, our topic is. 1 second, sir. Let me share the screen now.
Yes, yes,
Today, our
yes.
topic is experimental regimen. So, very well, Dr. Hahnemann explained about the mental diseases in Aphorism 210 to 230. In that, Aphorism 228, he explained that in mental and emotional diseases resulting from corporal maladies, which can only cured by homeopathic antipsychotic medicines conjoined with carefully regulated mode of life and appropriate psychical behavior towards the patient on the part of those supporting him. And it must be observed by a way of auxiliary mental regimen. What it means, auxiliary mental regimen? The word auxilium, the auxiliary means auxiliary, the Latin word originated from auxilium. It means to help or it providing a back support to a system or to the treatment. So in that aspect, what kind of support, the back support can be given to the patient along with the homeopathic medicines. So nowadays we are regularly facing a kind of issues like my son is very stubborn nowadays. He's addicted to the phone. I don't know how to convince the patient. Even the adults also nowadays, they develop on the games, the internet addictions, or internet gambling, we can say, and how to get rid of the complaints. And even we are dealing with many psychotic cases and depression cases. And we know we are giving some advice to the patient, but I just want to make it as a technical one. What kind we can give the advice in the name of psychotherapy to the what cases? The equal amount of effort or equal kind of counseling cannot be given to all the cases. Typically speaking, each and every disease has its own peculiarity, and according to the case and according to the cause of the disease, our methodology should be a little bit different. Let me explain it in the upcoming slides. The first thing, the psychotherapy, it can be defined as the treatment by the psychological means of the problem of an emotional nature in which therapists deliberately establish a professional relationship with the patient. So making a psychotherapy is nothing but a professional relationship between the doctor and the patient. The three things must be the point towards things. Which one? The first one is to remove or modify or retard the existing symptom. The first goal of psychotherapy is remove, modify, or retard the existing symptom. The first point. And second point, mediate disturbed pattern of the behavior. And third one, promote positive personality growth and the development. So the three things must be established by means of the psychotherapy. And we know, generally we know about the psychotherapy and what all the different varieties of psychotherapy that we will see now. Everyone will know about this personality. Sigmund Freud is the founder of the psychotherapy, psychoanalysis. The Freudian psychoanalysis typically needs 2 to 5 visits per week by the patient for a period of 3 to 5 years. Sometimes it requires even a longer time. And in this method, no detailed history is needed. Mental state examination is not needed. The formalized psychiatric diagnosis is not necessary. The only thing what we have to do is let the patient to communicate. The process is called a free association. And there are one more technique that is also called a dream analysis. In two way, we can go with the psychoanalysis where it will help. Psychoanalysis நம்ம எங்கெல்லாம் யூஸ் பண்ணலாம் அப்படி கேட்டீங்கன்னா, and the first point, when the patient is having any past mental trauma, especially that happened in the childhood days, okay, especially in the mental trauma, the suppressed or repressed wishes which makes the patient to feel guilty. So the most of the time the patient have the neurotic complaints the so-called the medical term is conversion disorder. Most of the patients with the conversion disorder, but they may not aware of the cause of the disease, but still continually they used to explain some symptoms, and all the diagnostic methods fails to reveal the cause or pathology behind the disorder, and where the psychology is a important one. For example, it's a Freudian case, Mrs. Elizabeth. He suffered with the paresthesia, a numbness in the foot, a tingling sensation in the foot, conversion disorder. It when it started means she had a crush on her sister's husband, and ultimately she felt okay, it's not the right thing. I should not fall in love with that sister's husband. It should not be. So she suppressed her wishes. Actually, it's the right thing only, but she suppressed wishes. At the same time, she felt guilty. Oh, I should not have done this. I should not think my sister has been in such way. So her guilty conscience make her to develop the symptoms of paresthesia. So all the diagnostic methods failed in such cases. Finally, she visited Dr. Sigmund Freud. He led her to express the things, whatever she feels, she can deliver. So there is no interaction, there is no questionnaire method, and no such attempt to diagnosis. She has to explain the things, whatever she feels in her mind, she has to just deliver in front of her. That's the only thing she need to do. And finally, she herself narrated, and this is the thing, I had such wishes in the past of my life, and I felt guilty, and after that the symptom was started. And finally, the fixation, we use the term is fixation. The fixation is resolved in that area from that time. So she became free from the symptoms, that conversion disorder. And for dream analysis, we had one more example. A girl who had a repeated dreams of a death of an cousin brother. Even though the child is more attached towards that girl, but even she repeatedly get that the dreams like the boy is about to die. She was very confused, and she visited Dr. Freud. And by dream analysis, they come to know the girl actually had a crush, but it was strongly opposed by the family members, and she was prohibited. She was it's like a home arrest. She couldn't see her boyfriend. Then later on, when the girl's father passed away, she met him in a funeral one day. So after which she didn't meet that person. So that internal wishes, that desire motivates that girl. Okay, if some other thing in one more funeral is happened, she can meet them. It looking for an opportunity. The mind that wishes, constantly seeking an opportunity to seek that boy. So these wishes expressed through the dream that someone is about to die, and she is more affectionate towards the cousin. So generally she gets the disease like that particular boy is about to die. So by this dream analysis, the fixation was resolved. Thereafter she didn't have such kind of dreams. So this is the important, especially when you are dealing with these cases, when the case with the psychiatric diseases and not with any pathological changes, the cause is not evident to a physician, and the psychoanalysis will be a better method to evoke or to reveal the problem of the patient. So psychoanalysis is the first method, we can say, where the patient and doctor is not directed towards the patient, or generally sit behind the physician is sitting behind the patient. And the next developed method is the psychoanalytical oriented method. And when compared to that psychoanalysis, the duration of psychoanalytical therapy is little bit briefer. And here the advice is given by the physician towards the patient occasionally, not necessarily, but occasionally it happens. The patient and the therapist may sit face to face, and coach is used. And the rest of the techniques are almost nearly to the psychoanalysis. The patient is allowed to narrate the complaint, whatever they feel, let them narrate to the physician, and by which the suppressed wishes are coming up to the surface level, and the fixation will be resolved. And this is also, it's like a psychoanalysis, psychoanalytical therapy also used in case of neurotic disorder and also in the personality disorder. The second method we can use in the cases without any pathological changes. And third thing is very, very important nowadays, what frequently using the day-to-day practice is behavioral therapy, we know the Pavlov's dog experiment and that operant conditioning, which is expressed by the Skinner. And behavioral therapy is nothing but it's about the learning process. Behavioral therapy is a type of psychoanalytical therapy which is based on the theories of learning. So whatever the thing that can be regulated, there is a term is called a tabula rasa. The children are like a blank slate that can be written. How we try to treat the individual or try to treat the child, we can make it. It's like a soft clay. We can mold the childs by any means by the process of learning. It aims at modifying the maladaptive behavior and substituting in which the adaptive behavior. So with that, we can understand the behavioral disorder, especially the behavioral disorder of children can be regulated by means of this behavioral therapy. The majority of the behavioral therapy techniques are based of operant condition of the model, so-called the Skinner's that I will explain in a few after a few slides, and the classical condition of the Pavlov. The learning theory assumes that all behavior is learned behavior. So typically speaking, the behavioral therapy is a short-term therapy. The therapists are easy to train, and generally it's a cost-effective. The total duration of therapy is usually 6 to 8 weeks. The initial sessions are scheduled daily, but the later session can be more spaced out as per the need of the psychologist. The behavior analysis is usually carried out before planning the behavior. So generally speaking, how we can regulate the behavior of the adult or the children or in generally a person, those who are having a misbehavior, and how to handle the such situation is simply the three things must be notified while taking the case. The first thing is a antecedent and what circumstances the behavior start begins. So when you find the abnormal behavior or the misbehavior from the patient side, what is the circumstances or the triggering factors which trigger out the condition? That's the first point, A, antecedent behavior. And the second point is behavior. What kind of behavior? The persons, after such circumstances, after such a triggering factor, what kind of expression the patient is giving, whether they become irritable, they become anger, or become impulsive, or any other mood. What kind of behavior the patient is expressing. And the third thing, what are the consequences? So we know the triggering factor, and now we are clear about the behavior expressed by the patient. Now, what are the things which maintains the behavior? Even after removing such a triggering points, what are the things which maintains the behavior? The three things must be notified by the physician. If you want to regulate any maladaptive behavior, first you must know the antecedent thing and the behavior, and what are the consequences which will maintain the particular behavior. And these three things must be modified. And what are the way we can modify that? That operant condition of the Skinner teaches us how to regulate such misadaptive behavior or maladaptive behavior. The three things are explained here. The first thing is positive reinforcement, and the negative reinforcement. A third thing is modeling. And with these images, you can understand the first point is positive reinforcement. What is the review given to the product? So it acts as a positive reinforcement. Okay, and we are giving a rank or awards. Even the IT field, they are giving a stars nowadays and the incentives. So these are all act as a positive reinforcement, which stimulates or which helps to maintain the behavior. If someone is doing the good things, or when there is a misadaptive behavior, okay, if you're not repeating that, I give you a chocolate, I give you or some other things, I will take you to a movie. When you're giving some rewards in the positive aspect, the misbehavior can be diminished. The first point you have to do is positive reinforcement. In case if positive reinforcement is not working, then you can choose the second method to correct the behavior is negative reinforcement. So like the Colgate ad, what I'm showing this picture. So if you are not brushing, and you will get the infections, and you will get the gas after the stomach, the infection will enter the stomach, and you will get all this blah blah blah. So this is the negative reinforcement. This is not like threatening the individual, or this is not like a punishment, but you are trying to explain the negative consequences after such misbehavior, and you should not repeat it. In such way, you can advise the patient to stop some misbehavior. And the third thing can be a modeling. The person exposed to model behavior and is induced to copy it. We know, and most of the things we are copied from the movies nowadays. Then even the crime scenes, or even good things, even some bank robberies in recent days we see in news, and many things are copied from the movie. The movie sometimes became a good example, at the same time bad example too. That is called a modeling. And the better role model can be shown to the person or those who are having a misbehavior. Every time we cannot say that the patient, but the persons with the misbehavior. And this can be rectified by the three means: either by the positive reinforcement, or by the negative reinforcement, or by the showing good modeling. And the three things are essential. And there is another technique also to decrease the behavior. The first three things is to increase the behavior, to reduce the misbehavior, or to increase the good behavior. Now, just to reduce or decreasing the behavior, the first one is timed out. Here, the reinforcement is withdrawn for some times, and contingent upon the undecided response. Timeout is often used in therapy settings. Okay, it's a simple thing. Timeout is simply experiments. So the child is under examination pressure. The examination is over, we are taking the child to a tour or any hill station or any other vacations, right? So this is like keeping away from the stressful situation for the moment is simply timed out. So whenever a child or a person is under constant stress, the constant stress leads to misbehave in a particular situation, and you have to give a timeout. You take out the person from the particular undesirable situation and keep them calm. Gradually, the patient become to a normal state. And if time is not working, again and again, the person is having a misbehavior. And the second thing is punishment. So aversive stimulus is here presented contingent upon the undesired response. And if you the punishment is given to the child, the undesirable behavior or gradually weakening. Okay, but keep in mind, you should not give punishment immediately, and your punishment must be so strong, and your punishment should not be repeated often. That in punishment is the main thing. If you are giving a very weaker punishment, it generally it won't diminish the misbehavior of the individual. And if the punishment is, even if it is strong and often repeated, and it may end up in the negative consequences. The negative aspect of the child will become increased, and he became the antisocial personality disorder. And there is a chance of increasing the misbehavior by means of continuous punishment. And the third thing is satisfaction. And the undesired response is partially reinforced so that tiring occurs. So this movie we can see, there is a Rajini movie in Tamil called, I think so, Arunachalam. In that, the father Rajini, the scene was like the father Rajini explained that once I smoked a cigarette, my father caught me. He didn't punish me actually, but he let me into the room with full of cigarettes. The whole room have cigarettes, and I was instructed to finish all the cigarettes within the overnight. So I tried to finish it off as much as I possible. The whole night I smoked, and finally I fed up with the smoke. And from that day, I never touched it. I never touched the cigarette. So it's a kind of example for the satisfaction. So whatever the patient is so decide towards the thing and make it repeatedly, you ask them to repeat to some extent. Okay, and this satisfaction may give a saturation to the unwanted desire, and the behavior can be reduced gradually. And the three things: and modeling. And the three things can be done to modify the behavior or to decrease the behavior. That can be timeout, punishment, and citation. And this is the key factor to modify. Where and all we can use it அப்படின்னு பார்த்தீங்கன்னா, the behavioral therapy, where and all we can use it in eating disorder, in post-traumatic stress disorder, in bipolar disorder, in attention deficit hyperactive disorder, the phobic conditions, especially in the social phobia and OCD, depression, anxiety, panic disorders, anger issues, self-harm, and that is the suicidal ideations or the impulsivity, and including the substance abuse disorder. And these are all the conditions generally require behavioral therapy. In such conditions, if you want to treat the persons along with the simple advices, along with the counseling, what generally what we are saying, the advices, the counseling, definitely the persons will not be better with your medicine alone, or not will be, you will not be satisfied with your counseling. And these kind of behavioral methods should be adapted towards the case, how to increase the positive behavior or positive psychology, or how to decrease this unwanted behavior. The behavioral therapy will be a optimum therapy in such cases, and along with your homeopathic medicines. And whereas, okay, let me explain this first. Cognitive behavioral therapy. The next one is cognitive behavioral therapy. The word cognition itself, we can understand the problem solving capacity. The cognitive behavioral therapy is a type of psychotherapy which aims at correcting the maladaptive methods of thinking that provides relief from consequent symptoms. The therapists play an active role, unlike the psychoanalysis. Psychoanalysis and psychoanalytical therapy, generally the physician is passive, the patient is allowed to speak. But here in cognitive behavioral therapy, the physician becomes so active, he interacts with the patient, and he gives a possible solution to his problems. It used for the treatment of depression, anxiety disorder, panic disorder, phobia, eating disorder, and anticipatory anxiety. The difference between the cognitive behavioral therapy and the psychoanalysis, the psychoanalysis patient or the patient does not know what the complaint he is having, because the thing happened very long back. The so-called mental traumas that happens in the childhood, the suppressed wishes and depressed wishes, those wishes are in the unconscious level. The unconscious mind motivate or urge the individual to act in such a way. Okay, the patient might forget the thing. It means not in the conscious level, not in the subconscious level, but it is in the unconscious level. Even they cannot recall it easily. So the patient might not know the cause of the disease. Still, he is looking for the cause by means of so various investigations, CT brain, all those chemical analysis, so-called blood tests, whatever it is, EEG and other things. And they're constantly searching for the cause of the disease where it requires the psychoanalysis. And here, the patient knows the problem. Sir, it happens after death of my so-and-so. And once I met with a financial issue, and thereafter I started developing such kind of issues. And one of my closest friends cheated me by so-and-so thing. I don't know what to do after that. I believed in him a lot, and it happens like, so he know the exact concept of the point. What we say is never well since before. So exactly they know the cause, and they don't know how to get rid of the complaint. That's the main thing different the psychoanalysis therapy and the cognitive behavioral therapy, and where you should give CPT and where you should give the psychoanalysis. So here you have to give a solution, the problem solving technique or problem solving solution you have to give to the patient, and based on the nature of the individual. The solution is entirely depends upon the individual's nature, that there is no strict rule to give any guidelines. Depends upon the case, you can choose a problem solving techniques. And a typical cognitive behavior therapy schedule consists of about 15 visits over a 3 months period. Some important techniques in cognitive cognitive techniques such as recognized and correcting negative automatic thoughts, and teaching re-attribution techniques, increasing objectivity in perspectives, identifying testing moderative assumptions. So these are all the tasks of CPT. And types of CPT. So there are lots of methods, lots of types in the CPT. The first thing we can say is play therapy. The play therapy is commonly used in the children's, and whereas the child is not able to express the irritability or the misbehavior, and we cannot, when we are not able to find out the cause, when the child is not able to communicate with us, even to the normal child or to the deaf and dumb or the autism child, or the child has a selective mutism. Okay, and there are a few more conditions too. And even in MR babies, and the baby is not having enough knowledge to communicate, but if you want to correct the maladaptive behavior, the play therapy is helpful to some extent. By watching the children's play, therapists are able to gain insight into what a child is uncomfortably expressing or unable to express just by playing with the child by using so many uh, uh, play items. Children may be able to choose their own toys and play freely. They might be asked to draw a picture or use toys to create a sense in a sandbox. So by which the psychologists get an insight into the problem of the child and they will try to rectify it. I'm not going depth into this therapy. I just want to share the things and what all there, what are the kind of therapies and what therapy should be guided to the patients. And the therapy is wholly, we cannot give directly the physician, the homeopathic physician, or even the psychiatrist. They can't give it directly. Only the trained psychologist, those who finished the clinical psychology can give these therapies, and we can refer it to a nearby psychologist if any. And we must know what kind of therapy that has to be advised to the patients. That's the main content of what I willing to share here. So the play therapy is helpful, especially in the children where the child is not able to communicate with the parents or to the physician. And it can be used and facing medical procedure, and when child is having a chronic illness or palliative care, even when the child is having cancer and become a depression, so depression by means of various kind of cruel treatments, and there is a developmental delay, when there is a learning disabilities, and if there is any problem behaviors in schools, aggressive and angry behaviors, and the baby suffered with the family issues, when there is with the separated parents or death of the close family members, especially the a nursing person, either mother or whatever, who were taking care of the child, and especially with the natural disaster when the child became abandoned, and the domestic violences, abuse, and of course eating disorder, toileting disorder is very, very important nowadays. The fixation happens in toileting behavior, and the ADHD, and of course autism spectrum disorder. And these are all the conditions a child requires of play therapy, and through the play therapy we can feel the comfort zone of the baby, and because of by the comfort zone we can correct the molar behavior of the child. And the next thing is systematic desensitization. The principle state that if a response incompatible with the anxiety is made to occur at the time as an anxiety provoking stimulus, anxiety is reduced by reciprocal inhibition. Okay, this thing, systematic desensitization consists of three things: relaxation training, hierarchy construction, and systematic desensitization proper. This is most useful in case of phobic disorder, systematic desensitization, and any diseases with the anxiety provoking things. And many patients used to say, I am having a fear of being alone. From the morning I'm so happy, I'm almost like a normal person, but when the evening happens I become so restless. I feel like anxious. I'm just waiting for when my husband will return to home. I don't know, at the time I don't know what I'm going to do. I feel like a butterfly in the abdomen, as a kind of nervous complaint I'm just getting. I feel like a palpitation and so and so. As a physician, we can assure the person, okay, it's nothing, it's just a depression or just anxiety disorder, it will be fine. You don't panic. The advice you can give easily, but the time of that particular triggering time, especially any triggering points, what I explained is the evening time, especially in the syphilitic manifestation, we can see the cause every company is aggravated the twilight actually, right? So it's easy to advise not to become panic by the time, but at the time the patient is out of control, that is anxiety disorder, and every person is anxious to some extent. But the problem arises when we are not able to cope up with the physical symptom which started during the phobic disorder. Every person started trembling, started developing the palpitation, a tight or rigid sensation all over the body. And these cases, especially the phobic disorder cases, can be treated with the relaxation techniques that I explained later, the hierarchy construction. And what we have to do towards these phobic disorder cases or anxiety neurosis cases you just ask the patient to list out all the conditions which provokes anxiety, and it should be listed in the hierarchy order. The very least anxiety provoking factor, very least fear should be labeled in the first, and other fears. If the patient is having only fear, that will be only one. And if you're having so many fears, and these fear has to be listed out from the least provoking factor to the higher provoking factor. Okay, and what we have to do once after making it into a list, and what we have to do, systematic desensitization proper is the third technique or third steps in this case, and this can be done either by the imaginary or by the real, and the lower hierarchy is confounded. The patient is advised to signal whenever the anxiety occurs. Okay, I just explained. This image is showing a fearful lady is touching a snake, right? You just imagine a patient is having a fear of snake, and whenever she says, I hear the snake sound, whenever I see the snake, I become so anxious and palpitated, or any other provoking factor. What you have to do is the first point in the third step of the systematic desensitization prop, you let the patient to imagine the snake first. Definitely, whenever the patient under phobic disorder or under anxiety disorder, even they imagine the snake, they started developing the physical symptoms, all the anxiety physical symptoms. So it has to be done first. And the second thing, you have to show the images or the videos that is pretty good about the snakes. It's not easy in one or two steps, and it's a repeated session, and the patient is forced to see such a videos. And the third thing, you can allow the patient to play with the toys, the snake toys. Let them touch, let them play, let them kiss, or whatever. Okay. And finally, you allow the patient to touch the snake. And this is the way, the first we have to visualize, and with that we have to see, and we have to play with the toys, and then we have to touch the real one with the safe measures only. We have to touch the snake. By this way, and whatever the triggering factor, by this way, every fear has to be desensitized gradually by one another steps. And systematic desensitization is a treatment choice of phobic disorder as well as the obsessive compulsive disorder. And this is very, very, very useful techniques. What I'm using in my day-to-day practice. I ask the patient to do it repeatedly, and I'm getting a wonderful result by means of this systematic desensitization. And instead of giving a simple advice, it works a lot. And the next method is aversion therapy. It's frequently used in case of alcohol withdrawal disorders. So aversion therapy is often used to treat problems such as substance abuse and alcoholism. It works by teaching people to associate stimulus that desirable but unhealthy with extremely unpleasant stimulus. So what they're doing is they give some medicines in allopathy. So by that medicine, whenever the patient is taking alcohol later of the drug, the patients are induced to vomit. So that will be the chemical reaction once after taking the tablet. So the patient started feeling like, okay, hereafter if I take the drink, then I will start vomiting. I will get all sort of pain, stomach pain, and irritation, retrosternal burning pain. Okay, better not to touch. So gradually it comes to a mind by means of this aversion therapy. It helps in many places. Of course, in village side, we can say when the child is having a thumb sucking habit, they apply the cow dung over the finger. This is also a kind of aversion therapy. So we have to make the person, we have to make some situation to make it as a undesirable stimulus. So aversion therapy is helpful in such cases when there is nail biting, thumb sucking, alcoholism, and in some other behavioral disorder. And another techniques to get away from the fear is flooding. So the image shows like a person's are jumping into the well. So whenever a person is about to teaching swimming, the person is feel hesitating and they have fear of drowning into the water. They never jump into the water. They just simply standing at the place. But what the thing they will do now, the trainer simply they will push the child into the water. And he knows the depth of the well, and he know he will save him somehow. The probability of the escapism is possible. Okay, the person is directed to explore the phobic stimulus, but escape is made. That is impossible. That is possible actually. Okay, by prolonged contact with the phobic stimulus, therapist guidance and encouragement, the therapist modeling behavior, anxiety decreases and phobic behavior are gradually diminishing. You let the patient to face the problem. A girl is having fear of cockroach. Let her face the cockroach. Let her throw it out. So likewise, the patient is not like a desensitization. It's not we are doing it gradually. We are not reducing the behavior in the flooding. We are directly enters the patient to face a fearful object. And supportive psychotherapy, and this is a very directive method of psychotherapy which focus clearly on existing symptom on current life situation. As like cognitive behavioral therapy, of course, it's one of cognitive psychotherapy. It helps to correcting the situational problem and symptom certification, restoration or strengthening of defenses, prevention emotional backgrounds, and teaching of new coping skills. And this is what we are doing in our routine practice. Suggestion. That integral part of supportive psychotherapy, it is often used alone. It is used nearly by all medical practitioners without realizing or naming of its suggest. So what we are doing is generally a placebo response. It's a suggestions. We are giving some suggestion to the patient. The patient may follow or may not follow. But if our suggestion is in a technical way and whatever we discussed exactly in the technical way, whether it is as per the case, whether the case needs psychoanalysis or whether it is the cognitive behavioral therapy or which case need a systematic desensitization, we know that very well if we are giving a technical guidance to the patient, and most of patient will get away from the disease along with our homeopathic medicines. And these are the most common thing we know very well. The family therapy is there, marital therapy is there, and group therapy. Group therapy is very much helpful in cases when, especially dealing with the Alzheimer's disease in the elder individual, and as well as the patient, those who are under palliative care, and they are fed up with the chronic treatments and the cruel treatments. The group therapy helps the individual to cope up with the situation. And this is like a discussion in a hall. Those whoever is suffering with the, for example, any geriatric patients suffered with the cancers, they fed up with the treatment and the restrictive mode of life, and they are allowed to discuss with the other people, those who already come out of the situation, those who finished the treatment, cancer treatment, and those who are now feeling more comfortable or allowed to speak in front of those suffering peoples. And they affected peoples are gradually getting the confidence. Okay, they're getting confidence like, okay, we also will come one day like this, we will get rid of the symptoms, our pathology will be relieved, our lifestyles will be modified, like that. Gradually they're getting a confidence. So group therapy is helpful. And of course, in the child, those who are having a MR, the MR babies are more prone to develop depression, and the persons having learning disabilities or dyslexia, and they are not able to cope up in the classroom sessions, and the group therapy is much helpful in such conditions. And hypnosis very well. Hypnosis started artificially induced by increasing suggestibility. This is like gaining insight into the subconscious or unconscious part of the patients, not simply like psychoanalysis. In psychoanalysis, patient himself wants to needs to explain the things, but here in hypnosis, the physician directly interacted with the persons and getting into that unconscious part of the patient. And relaxation therapies. Already in the systematic desensitization, I explained the relaxation training and the hierarchy method, and the last step is systematic desensitization proper. And the relaxation techniques I just want to share on is Jacobson progressive muscular relaxation. This is very, very useful in dealing with the anxiety neurosis. So this relaxation technique, you can Google it or you can see in the YouTube itself. Nothing but that technique is not to get away from, not to remove the cause of the disease. There is some triggering factor. To the triggering factor, the patients have started developing the anxiety symptoms. They feel tensed and all kind of palpitations, sweating and all. But these progressive muscular relaxation, what happens now? The patient has to be stiff their whole body gradually. First, the lower limb must be tightened, and then the upper body, and then the neck, and then the head. And they had to have gradually release it in the downward again. The head has to be relaxed little, and the neck region, and the upper arm, and the body, and the lower arm. So like this way, they have to stiff it or either constrict it and have to relax it. They have to constrict and relax it in the gradual manner. So it helps us to get away from the symptoms. So the triggering factor will be same, and the patients gradually learn how to handle or how to cope up with the physical symptom during the anxiety provoking conditions. And the relaxation technique is helping very much in my daily practice. So Jacobson progressive muscular techniques and the hypnosis are very, very helpful in the relaxation techniques. And along with that, we can ask the patient to do a regular meditations or the yoga. Shavasanas also helps to a little extent, and yoga, pranayama, vipassana, and of course the fire effect. And these are all the techniques which helps the individual to get away from the stressful situation as well as the anxiety provoking factors. So these are about a little something, and we have so many techniques. There is a pre-action system, marital therapy is there, and sex therapy is there, and we have enlisted of therapies, rehabilitations is there, and this, I hope these techniques are you are well aware of it. And of course, occupational therapy is there, vacation therapy is there. So it takes much time if you started speaking these things. So I just want to finish it by this slide. And of course, speech therapy often helpful in case of dyslexia, dyspraxia, aphasia, dysphagia, and even to extend the Parkinson's disease, cerebral palsy, Down syndrome, multiple sclerosis. So there are better therapies. And one more important thing is mirror therapy. Mirror therapy is often helpful in cases in the rehabilitation method. If a person lost their limb or if they lost the arm, they feel the neuritis complaint in the side where they lost their limbs. They feel neurotic complaints, the nerve ending. Generally, it has to be treated with mirror therapy. What, like how it is shown in that image, the person has to sit in the middle of the glass. So this image look like it gives the imaginations or the image like the patient is having two arms or two legs. So once you move the one arm, and automatically your mind is that you have another arm that also have the movement and sensation, all those things. So psychologically, it gives the relief from the neuritis complaints after the amputation, and it is also it also gives a very good result, especially when dealing with the amputated individuals. And recreational therapy just making a fun by grouping methods. So whenever you are suffering with a major depressive disorder and you are fed up with the conditions, especially in the acute stress disorder, a recreational therapy often helps to get away from the symptoms. And reverse therapy, you have to show the opposite reaction that you can see in there is something we call a Petromax. Here in this personality, what is shown in the image, whenever they feel fear, it actually is a ghost movie. Whenever they feel a ghost or when they become fear, he advised by the psychologist, he has to laugh instead of become panic out of fear without showing the emotion. He has to laugh a lot in order to avoid the faintings or to avoid the anxiety symptoms. That is called reverse therapy. So that's all about the therapies. I am just sharing very little things to you, the time concern. and I hope it at least it extends our knowledge to some extent.
Yes, definitely, Dr. Kathiravan, it's a very good presentation from you. We are all happy to have such a presentation because the mental trauma people suffer from these kind of diseases are really great, and there are different methods by which you can correct these things, and you have shown how beautifully one can rectify all these things through different technologies and techniques and therapies, and this is really an eye-opener to all homeopathic doctors to practice these technologies or these therapies to offer speedy cure to the patient. The physicians, the high and only mission is to restore the sick to health, and this is what Hahnemann has mentioned in his aphorism number 1, and this is what we are supposed to deliver, and you have shown beautifully that we can deliver all these things by means of these auxiliary mental regimen or by auxiliary mental treatment, whatever may be. But we are delighted to have such a session. I hope that you can present some more presentation in the future, as these sessions are very, very good for the upcoming homeopathic doctors as well as to the public also. So let me begin the sessions in a discussion from another legend from homeopathy field. He is none other than Dr. Sridhara Kurup, who is a retired deputy director from Central Council of Research in Homeopathy, Kottayam. So it is up to you, sir, Sridhara Kurup, sir, to begin your session talk.
Dr. Kathiravan, it was extremely good, and it is surprising. You are finished entire psychology within 45 minutes. It might have been made into sections by one after the another. It was little fast. And otherwise, it was excellent, except TA and NLP was not mentioned, except all other A to Z that you are mentioned. Thank you very much. Keep it up. That whether you are having any knowledge about the TA or NLP, I
No,
like
sir.
to, okay. That is also two psychological tools. It is very useful in treatment, in psychological treatment, except that you are mentioned everything. It is absolutely, we can say, excellent. Thank you very much.
Thank you, sir.
Keep it up.
Thank
Come
you, sir.
again for such wonderful section. Along with our homeopathic medicine, these type of the tools, if you may apply as a complementary, you can give. Of course, we are having very good medicine for phobias, anxiety, fear, and depression, everything. But along with that, these type of the auxiliary treatment, if you may give, that definitely we can, our good rate will be improved, and it will shorten our treatment. Thank you very much. Keep it up. Come again with such another session. Thank you very much. Wish you all the best.
Thank you, sir. Thank you, sir. And sir.
Okay.
Yes, this was a very good comment from Dr. Sridhara Kurup, sir. Dr. Kathiravan, please stop screen sharing so that we can see everyone. Oh.
Sorry.
Okay. Then so that we can still the screen sharing continues. So that we can person who are raising hands and okay.
Thank you, sir.
Dr. Hibbert can speak. Please unmute you, Dr. Hibbert. He's another person who is always here to moderate and let us invite.
Hello, doctor. Can you hear me?
Yes, sir.
It was very wonderful and very nice class, as Sridhara Kurup sir said. I want to ask you, you are a product of Annamalai University.
Yes,
your
sir,
name...
but it's a I have done the postgraduate on postal course only, sir.
But I want to ask you whether there was one Kathiravan sir in Annamalai University. You have any relationship with Dr. Kathiravan?
No, sir. No, sir. No, sir.
Do you know him?
Not sorry, sir. I don't know, sir.
I was
Might be,
coming.
sir, but I just I thought by 2010 you were taking class. I hope so, sir. Two session I attended there. I look like I'm not sure whether I'm right or whether you have taken the class in 2010. And 6 months once I visited university and stayed for 1 week to attend the classes and along with the practical classes. I feel like you were there, but not sure, sir.
Okay,
It
okay.
happened around 12
He
years.
is having one relation that his name is also Kathiravan.
Yeah, Kathiravan. So I am
Sir.
asking you.
I am also student of Dr. Kathiravan in Annapalai.
Oh, sir.
I took.
You were a person, sir. I'm not sure. Sorry.
I took I was 2022 02. That time I studied.
Oh, fine, sir.
21 years back.
21 years back. That's
Okay, very nice class, sir. Your presentation is very nice, and you are always welcome to our platform. Thank you, doctor. That is what I
Thank
want
you,
to
sir.
say.
Thank you, sir. Thank you very much. Sir.
Doctor, we want to know something about homeopathy in your place. Homeopathy.
In my place means, sir.
You are now at Salem or Coimbatore? And
Sir, I finished my MD in Salem, sir, but currently staying at Coimbatore. Since 2012, I am practicing at place Homeopathy.
yes, a lot of disturbances are coming. Everybody,
Someone need to mute it.
A lot of disturbances coming from different people. Bhaskara, please unmute. Okay. That was the most troublesome sound we are getting from.
Now it's fine, sir.
Yes. What's your opinion on homeopathy in Coimbatore? Whether a lot of people using homeopathy or only
It's a maximum of the questions, sir. When compared to other area in Coimbatore, Coimbatore having a better scope, especially it's almost near to Warriors, around 10 kilometers only. So as like the people supporting in Kerala and here also, the people are supporting homeopathy a lot, and they're not even wants to go for even for a single fever case. They don't want to take allopathic medicines. They prefer homeo in the first line, and as a second option, if it is not available, then they are preferring for Ayurveda. Even Siddha is not having much. I don't have much idea about Siddha, but here the homeopathy doctors are very in number. When I start practicing by 2010, it was around 1 or 2 doctors in my place. But now we are having around 15 doctors within 2 kilometers radiations.
Oh, very good.
That what I can see in the commercial areas I can see. But even many practices are without making commercial places. Even their home itself practicing. If we're counting it, then it becomes more. And minimum of 15 doctors are practicing in that commercial area within 2 kilometers from my observations. The 10 years of duration, it became so vast. And there are lots of students, even Martin College as well as RVS College, the students from my area is increasing gradually. So earlier I found only 1 or 2 students from area, but now minimum of 4 to 5 students every year. So homeopathy is growing.
That's what we want to do, because homeopathy is the second largest practicing system in the world. And we have to grow everywhere. We need to grow it everywhere, just like in Kerala. You know, from Kerala, there is 5 to 10 doctors in 1 kilometer radius.
And it is happening in Coimbatore also, so I hope so. It is happening in Coimbatore also. We can find so many doctors in the same area. But thing is, I think the lack happens in promoting.
What kind of support you are getting from the government for propagation of homeopathy?
It's better than before. They're getting Nowadays they give calling for the jobs, but the thing is not in the numbers. They are calling for.
There a dispensary in every panchayat. Do you know?
No, so not yet. Not yet. I think the background work is started. Government will initiate it very soon, sir. Currently not, but it will happen very soon. I hope.
Okay. These are the things people want to know, because we have to promote homeopathy every part of the world, particularly in India. But friends, as you all know that homeopathy, the International Forum for Promoting Homeopathy is celebrating the first family meeting on 15th of 19th of this month, that is on coming Sunday, and we will have a wonderful session on that particular day. I think our Vice President, Dr. Shaji Kudiyat, is here. Dr. Shaji Kudiyat, I welcome you to say a few words on that here. Dr. Shaji Kudiyat, please unmute yourself. And he is the Vice President of the organization, and he was the person instrumental in bringing up such a beautiful forum for us. He was working at the Philippines during the time of COVID, and along with some of us in Dubai, the Homeopathy Lovers, we started this forum, and we invite Dr. Shaji Kudiyat, the Vice President, to say something on that.
Thank you, Dr. Danesh. It is happy to see all of you, and inviting. I think our registration is closed already, but you can contribute and support us, and we will be having our first Zoom physical meeting on coming Sunday in North Parur, and many of us may be seeing for the first time, because this organization was initiated during the COVID-19 period to establish and promote homeopathy as the best healing modality and for prevention of viral infections around the world. So we are succeeding, and we are going ahead every day with our Zoom meetings in promotion of homeopathy internationally through this English session daily. So most of us joined from different part of Kerala and different part of India and different parts of the world, and most of us are never met each other. So this is an opportunity for us to see each other and start our physical meeting and know each other. So it will be, I'm looking forward for that day. And I request all the participants to support us in whatever way we can, joining us or contributing to us, so that our existence and promotions will be continued. My video I will not be opening. I'm not prepared to give a talk or see you online today. So thank you for the invitation. See you on Sunday.
Thank you very much, sir. It's time to wind up the session. I invite Dr. Hibbert to say the vote of thanks, and thereafter we will go to the Malayalam session. Dr. Hibbert?
Yes, Dr. Kathiravan, I already said that because of that name itself, we love it, because such a teacher was there, and so you are from the product of them, and so we are very much happy to see you, and your class was very nice, and you, as Dr. Sridhar Kapoor sir said, you all almost all completed the different parts of the psychological part, but you are lacking attaching with the homeopathy. Next time we expecting that a good class from you with attachment of homeopathy with our the psychology. Thank you very much, doctor. Thank you. You are always most welcome to our platform.
Thank you, sir. Thank you very much, sir. And I just want to thank Dr. Danesh, sir, and IFPH for giving me a good opportunity to deliver my knowledge. And also I want to thank Dr. Ismail Said, the president, and Dr. Shaji, sir, And of course, sir, yourself, Dr. Hayward, sir. Thank you very much, sir. And I also want to thank Dr. Franklin Gino, who introduced me this platform. So thanks a lot for everything, sir. Thank you.
There is an announcement. Tomorrow we will have a session from Dr. Shirley George, and the subject will be nutrition and lifestyle in pregnancy. So with that, we come to the end of the Malayalam session, and it is up over to Dr. Ashok Kumar for the continuation of Malayalam program in our local language.